Well, it's pretty safe to say that going to the dentist isn't always a pleasurable experience, especially if you have cavities.
But there's a new way of treating the decay with no numbing or drilling.
We found a practice in Cheshire that's using laser technology on its patients.
Melissa Cole went to see it in action.
Imagine going to the dentist for a cavity and not getting Novocaine or the drill. Well, it's true at Dr. Renee Kurtz's Healthy Dentistry in Cheshire.
So my office invested in a Solea laser. It is a CO2 laser that works on teeth and on tissue, and we don't need to use Novocaine when we use it. So instead of a needle and a drill, we can just laser the teeth and do fillings, crowns, tissue work, whatever we need to do.
Wow, so this is really good for patients who are not a fan of coming to the dentist, right? Because they're afraid of getting the shots and all that?
Most people are afraid of the needle. And then a lot of people don't like being numb for half the day. So we take that right away, and it's comfortable. You don't hear that really high pitch of the drill, and people are loving it. So this is the laser. The laser and the water come out on this side.
Dr. Kurtz aims the laser right on the tooth that has decay. Right now, she's working on a patient's 2 front teeth.
We're doing a couple fillings on the front teeth here. You can see it's got a little bit of decay right along these front 2 teeth. So we are going to remove that with the laser.
The laser removes all the areas of decay.
Yeah, so the laser pulsates about 10,000 lasers per second, and as it does that, it dulls the pain receptors of the teeth for about 10 to 15 minutes. So I can take out the cavity, I can fill the tooth, and by the time I'm done, the tooth is back to normal.
In a matter of just a few minutes, the cavities on Mark's front teeth are gone.
Instead of getting the patient numb and waiting for the Novocaine to set in, which will take another 5-10 minutes or so, I'm all done with the removing the decay.
Dr. Kurtz then fills where the cavities were, and the whole process is complete in about 25 minutes.
So does Mark need to wait now to eat or drink or anything like that?
No, he can eat and drink. He can go about his day. He's going back to work, so he doesn't have to be numb for the next few hours. He can drink his coffee, whatever he needs to do.
So is this your first time having it this way?
Yes.
And what was your experience like?
I'll do it again any day, even though I don't want a cavity again.
Well, what did it feel like?
It's just kind of like cold water on your tooth at a constant flow, and really the rest of it you don't even feel. You don't feel any drills, you don't feel any sharp pains, no annoying grinding on your tooth. It's awesome.
It works on gum tissue as well if you need to have periodontal surgery or just need to cut some tissue back. Especially with kids with braces, when their gums get really inflamed, we can cut that all back with no Novocaine.
So what are people saying about this?
Oh, they love it. I mean, it has been a game changer, especially with children. With baby teeth, it is so easy to use. The children don't feel anything. You don't come at them with a needle, because once you do that, they
forget it.
They're not letting you back in.
What a remarkable procedure that is.
Yeah,
Dr. Renee Kurtz is one of the few dentists in Connecticut using this laser. She's accepting new patients.
Wow. For more information, you can visit her website, mycheshiredentist.com, and her office is located right on Highland Avenue in Cheshire.
All right.